Several big stories of immigration have made the news this week. A Guatemalan man was recently convicted in Las Cruces of human trafficking, holding migrants hostage for demand for payment. An increasing number of migrants seeking asylum have flooded our state's southern borders, and cities further up north are being asked to step up, including Albuquerque right here. Tom, churches and other aid groups have been taking on the care of many of these refugees before they can be transported to their sponsors in other parts of the country. As a supposed sanctuary city, though, should Albuquerque be doing a little bit more for folks? Using that word, sanctuary city.
Well, Mayor Keller has been very vocal, asking New Mexico and Albuquerque residents specifically to all help out in different forms. I think the city itself is somewhat limited about the kind of assistance it can provide. But, I know that the Catholic Church has really stepped up to, help a number of immigrants. Different community groups as well have helped out in their own way. I think a lot of folks just don't know how they can help. Is the number one thing. And a lot of folks, I think, are still trying to get their head around what is or isn't really happening that's causing this great influx now into Albuquerque.
Point there.
And that confusion oftentimes, causes a paralysis of some sort, of people not knowing what kind of action to take.
Right. Good point there. Kathy, same question. We like to think we lead with our heart here in Albuquerque. It's kind of a big thing for us here.
Yeah.
Are we doing that in this situation?
I think so. I think that what we're saying is that people are welcome here, and I flipping through social media and I saw a post about someone who was saying that a lot of the families are coming with children, and maybe we need to provide a toy that they can travel with and to have some sort of memory of this time in their lives, because we know that it's going to be really telling for these kids as they grow up about what's going on with them now and in this particular time of their transition, and also just looking to see if what we can do, because these are real people, and like looking at them not as objects but as humans. And I think that we're really working hard to try to do that. So it's not just about making them a charity case, but about saying, now that individuals are here seeking asylum, how can we help them to be productive and not treat them as objects? So I think that Albuquerque is working hard to look at them as humans.
I like your point there about that time of their lives. That happens for a kid. A very specific time can be very impactful down the road. Interesting point there. We have a governor, Inez, that says we do not have a crisis at the border, at least when it comes to security. But there are different types of crises out there. And when you've got this many humans crossing the border, something's got to give somewhere. Can she stay on this tack in your view, or is this something that has to evolve over time?
Well, I think that a lot of what happens in her hands is tied by what the federal government is doing. So if you have a government that is seeking to break the law itself by denying people the asylum process, which is what's happening right now, things get more tangled up than they need to be. So while we have actual illegal immigration declining, now we have these people who are refugees, which is a legal process.
That's right.
The people coming to Albuquerque are seeking asylum. In that, they have a legal right to do that. So you still have to deal with what's happening, which is that the shelters along the border are full, and that people are going to places like the Boot Hill because they can't get in other places, because that's what the federal administration has decided to do. So what the governor did when she pulled the National Guard troops back, that I thought was smart, is she sent health workers down. She sent extra DPS, state police officers down to help with police and with those kinds of things. She has said she supports fences where they make sense. So to me, that's like a multifaceted approach that will work. If there's going to be more families coming, I would bet that we're going to have to step up state services. So I think she'll have to do that, but that's not the same as what the president is saying, which is that a horde of brown people are coming and they're all going to try to rape your daughter.
That's right. That's
and I think the fact that she's turning away from that kind of rhetoric makes me very proud.
Yeah, it's tempered thing locally, certainly. But Dan, there was a now infamous town hall meeting at the border not too long ago, where a lot of folks were telling a very different story about how they're seeing this situation, because they're living there. They're living at the border. Are we just not able to see this clearly up north here? Are we missing something in Albuquerque and Santa Fe?
We see how it is. We know it is. It's just a great political football for people to use right now.
Yeah.
I mean, we clearly have an immigration problem. Mexico and South America clearly has an immigration problem. And saying that we're not going to follow the laws that exist just because today we think that's the right thing to do isn't good for our country and isn't good for the folks trying to come into our country. The immigration process in this country is clearly broken. It shouldn't take 5 years to apply for immigration here.
Right.
It's clearly broken, but nobody in the political halls seems to have the wherewithal to fix it. What they want to do is they want to throw political bombs at each other. They want to call names. They want to try to obfuscate the law, do things their own way, when the reality is this has been a problem for a long time. And everybody, Republican, Democrat, male, female, black, white, doesn't matter, has punted on this issue. And I think that we're seeing the ramifications of a crisis that the government has failed to recognize, failed to address, and failed to fix. And so, the answer to me is you've got to address the root cause of the problem. And the root cause of the problem isn't, let's just figure out a way to get more people in the country and we'll figure out what to do once they're here, because clearly our system can't handle it. We know in New Mexico we have a already stressed medical system.
Right.
It's hard to keep doctors. Some of the problems in these smaller areas is they don't even have doctors, right? You've got folks coming in that need serious medical attention, and you can't even take care of the people that live in the community today.
I was just about to hit on that. There's reporting out there that folks are frustrated living down there. They feel like they're getting bumped for medical services.
It's happening,
For refugees.
and look, I think it's a shame to blame the refugees. I think it's a shame to blame those individuals. They're bearing the brunt of this. I get it, but I mean, it is a problem. We're talking about a state where, and I don't want to use names because I could have it wrong, but we're a state with almost 2 million people, and we have 0 pediatric neurologists in the state, right? So, if you start bringing in 50, 60,000 people to the state with children, and there's a problem, how do you address that? How do you address it? And so, I think that, instead of all of the politicians, whether it's the president of the United States or the governor of New Mexico, trying to get their, 15 seconds of fame by poking at each other, I think this is an issue that we need real leadership in this country on. And the lack of leadership is causing the tension to rise that I think is festering and going to be a huge problem for this country for a long time.
Fair point. Kathy, one of our colleagues, Janice Arnold-Jones, wrote an op-ed in the Journal recently talking about the dangerous complications that can spread from illnesses from people coming across the border. And I think what I gleaned from it was we need more services, if I'm hearing her correctly, to inoculate children and adults coming into the country if in fact they're going to come.
Right.
And that's going to cost money. Somebody has to set up those kind of things. Is that our responsibility? Should we be doing that? Did you agree with her on that, or is this something?
I'm not sure that I agreed with the tone of that column, and I'm not sure that she knows that there is a real crisis there. She's saying that it's a potential and certainly something that we need to look at. So, yeah, I think that if we allow individuals to come into the country seeking asylum, that we're going to have to take on some of those services. How we pay for it, I'm not sure, and it's something that, again, like Dan is saying, that we need to address and we need to look at from a holistic standpoint. So all the issues that are happening, we need to plan for those in advance. And I'm not sure that we've done that and what the leadership is around that, but yeah, we're going to have to take it on.
I know there's no small amount of irony on this vaccination issue. We have trouble getting kids vaccinated in schools right now, American kids, and now we're talking about vaccinating or immunizing, children coming across the border. Is that actually possible with the amount of the numbers we're dealing with? Unless you've got like a huge triage unit or some thing going on at the border,
They do it in Africa and in other countries, so I don't see why you couldn't. It is, you think about the wall and the way the president wants to spend the money that Congress has declined to appropriate, which is why we got into the constitutional crisis with him declaring the emergency.
Right.
Congress gets to spend money, the president then takes and has to live with that. He doesn't want to.
That's right.
So if you weren't building walls where you didn't need it, maybe you could spend that on immunizing people.
Sure.
It's really a matter of where you spend your resources and whether you want Congress to do its job, which is allocate dollars.
Right.
Then you go back to the big issue that immigration needs to be fixed. We need to take care of the dreamers. But most of the people that we're talking about now on the border are asylum seekers who are following the law, which our own country is trying to break.
Right.
So the lawbreakers aren't the people coming, it's the federal officials who are dealing with them improperly.
Gotcha. That's the idea of immunizing refugees coming. Politically, there's no small sense of danger there. Politically, that's a hard thing to kind of put yourself out on. Do you know what I mean? Whether federally or locally, You see what I mean? So that could be a real bottleneck at some point, trying to get that going.
Yeah, it could be. I think an easy fix to it would be for the Border Patrol and actually for the immigration naturalization teams that
right.
provide the all clear, as far as no terrorist threat. Why don't we at the same time provide the vaccinations that are needed? It's a lean, it's a very lean process to take care of everything all at once.
That's right. Dan, you have a thought on that? Is that something the government should be getting into, immunizing refugees coming across the border?
I mean, look,
Should Mexico be handling that? Should somebody else be doing that?
I mean, Gene, it's the problem, right? No matter how you address the problem, you're criticized for it and attacked for it. Look, the sheer fact, whether people are coming across illegally or now they've been educated at the border to ask for asylum, we still have these unbelievable numbers of people coming. We have people literally leaving Guatemala and Honduras and coming in caravans to come across the border. They're making a move to come to America. And look, we are a country of immigrants. There's no doubt about it. For the longest time, we've been a country of legal immigrants. We're moving away from that. And I think that the idea is either we're going to become an open border country and say, look, we're just going to have this movement amongst countries in our country, or we're going to follow the laws and say we have a process. The process is clearly broken. I think the sad part in this whole thing is that there are truly people that need help. And I think they're being overshadowed by people that are trying to take advantage of the situation.
Fair enough.
And it's making it hard to grant help to the true people that are up here. Because when you talk to some of these folks and see some of these organizations, there literally are people coming here that want a better life for themselves.
Sure.
There are people coming here that do not want a better life for themselves. We've got to figure out a way to separate those. And we should be pouring all our resources into helping those that want to come here to get here legally, get here in a timely fashion, and make them assimilate to life in America health-wise, and be good.
Good point there. It's all the time we have on that subject, but we'll be right back soon to cast a discerning eye on the education moonshot.